Hi everybody, I'm Dr. Duc Vuong. I'm a world famous bariatric surgeon. I'm the author of 13 books. I have helped train other surgeons in weight loss surgery. Why is a weight loss surgeon talking about coronavirus? It's because my patients are at risk, increased risk from this coronavirus. So I did this initially to help them, but now I understand that everybody's at risk for this, okay? So just to show you my credentials, here is my med school diploma. Dr. Vuong, you shouldn't be showing your personal information. Well, shit, this is the same stuff that I would put on my office, right? So Texas A&M University Health Science Center. There's my name. Now you know my middle name. Okay, College of Medicine and Doctor of Medicine. All right. So I'm a doctor. That's important that you need to know that. And I'm an MD. So I'm not a PhD. And that's fine if there are PhDs, but I'm not a PhD doctor. I'm an MD. I'm a medical doctor. And then here's my residency. In order to go, after you're done with med school, you have to do residency. So here's my residency certificate, Christus St. Joseph's Hospital program. I was the last graduating class. And here's my name again, already with the MD because I'd already gone to med school. Okay. And then general surgery. So I'm a general surgeon by training. I finished residency in 2005. Okay. So that's me. I've written 13 books. I was director of bariatrics in Albuquerque, New Mexico at Loveless Hospital. 3-hospital system was my last stint. And so I'm here to tell you about coronavirus. And this is super, super important. Okay? I want to explain the disease process first, how it actually kills you. And then I'm going to demonstrate it in a way that you won't be able to forget it and that you will want to share with your friends and loved ones. And then I want to give you the statistics to explain why this is super important. Okay? So do me a favor right now. Please hit share on this video. This is a super important video. We need to have lots of people watching this and spread this information. Okay? All right. So first of all, let's get our definitions correct. Okay? The actual virus that we're talking about is SARS-CoV-2. SARS, because this is a SARS virus that we saw earlier. We've had 3. This is the second form of this. SARS, CoV for coronavirus 2. It's the second one. All right. And the disease that it causes is COVID-19, COVID-19, coronavirus disease 19. Coronavirus itself is a type of viruses. It's a family of viruses that have been with us for a long time. Now, we are calling this the novel. Novel means new, not novel like you read. A novel coronavirus means it's a new coronavirus, right? SARS-CoV-2. And because it's new, there is no immunity to this, which means what? Everybody who comes in contact with this virus will catch it, will have some sort of symptoms. It can be mild. We're considering there might be some asymptomatic carriers, right? That's a whole different conversation. 80% are going to have mild case of coronavirus. And remember the definition. By mild, we mean you don't need to be hospitalized. So this is not the regular flu. So anybody who says, hey, this is just like the regular flu. No, it's not. This is, you don't need to be hospitalized. That's 80% of people. Okay? 20% of people will need to be hospitalized. Of those, probably about half are going to need to be in the ICU. And of those, about half will need to be on respirators. If you have a huge number, you do the math, we don't have enough respirators. Now, why am I talking about respirators? Because that actually has to do with how coronavirus kills. Let's get into this. So, coronavirus is a respiratory, breathing lung issue. Okay? It's a respiratory illness. That's important because if anybody who has respiratory issues already, you're at high risk. If you had a lung resection, if you've had COPD, if you're on oxygen, if you have sleep apnea, if you have poorly controlled asthma, you're at risk, guys. So that's a lot of people. Real quick, there's a direct correlation with coronavirus and bad outcomes If you have high blood pressure, that's most of America. That's a bunch of Americans right there. High blood pressure is and I'm going to explain why that's important. Okay, here in a second. High blood pressure, it's related. I promise it's related. Morbid obesity, that's most of my following. Now, if you've lost the weight, then you're at normal risk. But if you are BMI over 40, you're at a high risk. Okay, older age, but remember that numbers coming down. It's not 80-year-olds. We are warning 60-year-olds about this, and now we're having people in their 40s being hospitalized and people in their 30s dying from this. Okay, so this is really, really serious. Okay, so what does this mean? This is a respiratory virus. So remember, this virus is airborne. Okay. Listen, it's airborne, and it's also contact. That's how it's transmitted. So if you're around somebody who has the coronavirus and they sneeze and you're within 6 feet and you take a deep breath, you have a very good chance of catching it. Okay? Dr. Vuong, I'm an introvert. I'm not around people. If you kiss them, if you hug them, if they breathe on you, if they snore on you, if you understand, it's in the air, right? It's droplets. We think it's droplets. So it has to be droplets as opposed to being aerosolized where it can live outside without being in droplets. This is important because if it's aerosolized, if it's able to survive without being in droplets, then our masks don't do shit. Okay? But anyway, eventually this virus has to make its way into our oral airway. This oral airway. Okay? Because, and it's a weird, like sometimes we learn anatomy or know about it, but we just don't make the connection. Give me an amen if you've ever studied anatomy, but somehow it just doesn't connect, right? So our mucous membranes, our trachea, our nasal passages, our sinuses all come together in our mouths, goes down our throats, our scrawny chicken neck throats here, and then there's two tubes. One is our esophagus, where our food goes, and one's our trachea, which is where our lungs and our air passes. And that's where you, so people get confused by this. When you burp from your esophagus, your stomach. When you cough from your lungs, your trachea. So this is a respiratory illness. So the virus will make its way into your nose, throat, and then will go into your airways. This is your lungs. Okay? All right? So we're talking about your lungs. Now, I want to do a real quick demonstration. So imagine, Dr. Vuong, what are your lungs? Right here, guys. Okay? Put these here, and actually your lungs actually go up to your clavicles, believe it or not, if you want to be accurately. These aren't quite big enough. But your lungs are huge. So the top of your lungs go up right above your clavicle, your shoulder bone right here. They do. Trust me, they do. And they go way, take a deep breath. Everyone take a deep breath for me. When you do that, your diaphragm pushes down, and your lungs, if you go in your, I might have to jump for this. If y'all can see, way down here, you can feel your ribs. You can feel the bottom of your ribs is right above your belt line. Guys, your lungs go way down here, way down there, past, like almost to your waistline. Those are your ribs. So those are your lungs. Your lungs are huge. So these are small examples. I would really need a bunch all through here, all down through here. You guys get the idea, right? So now you have these two lungs, right? Now watch. Your lungs have little air pockets in them. They're called alveoli. You see right there? And like these little sponges here, there are little air pockets in here. All right? That's what I'm trying to show you here. That's what I'm demonstrating. These little air pockets. Okay? And that's how you do the gas exchange. Okay? Now to keep this real simple, there are two types of cells in your lungs. Type 1 pneumocyte is what does the exchange. of gases. So what do your lungs do, right? Take a deep breath. What comes in? Oxygen. Exhale, what comes out? Carbon dioxide, CO2. Well, the exchange between the oxygen and the CO2 is in type 1 pneumocytes, type 1 lung cells. Okay? Now, obviously, let me ask you this question. How long can you hold your breath for? 1 Mississippi, 2 Mississippi, 3 Mississippi. Maybe 1 minute. Deep sea divers can maybe do 5, 6, 7, 8 minutes. The world record is something like 15 minutes or something like that. But for the most part, most of us, you're talking about holding your breath for about a minute, minute and a half, right? So imagine if your head is underwater. I always tell my patients this story. It's kind of like if your pimp is holding your head in the toilet. If your pimp is holding your head in the toilet, how long could you hold your breath for? Right? Not very long, a minute and a half. First of all, why do you have a pimp? You know, you kind of messed up your life. You know, 2, if you have a pimp, that's God bless you. Sometimes you have to have a pimp in life. That's fine. I'm not judging, not judgy. But why are you pissed off your pimp? I mean, your life is pretty screwed up. So if your pimp is holding your head in the toilet, how long can you live for? Answer, not very long. Maybe a minute, minute and a half, 2 minutes, right? Without air. So this oxygen, now that, the reason why I'm telling you that is because it's super important. It's super important in terms of what I have to explain on how the virus kills, okay? So this oxygen exchange is super important. Now, there's another type of cell, type 2 pneumocytes, that's responsible for producing something called surfactant. Now, surfactant is, imagine like a little layer of like goo that lines, it's a real thin lining of your alveoli, right? And it keeps the alveoli, helps it to collapse and expand. Collapse and expand. Super important. So, you're around somebody that coughed or you kissed them and they're infected, or you're out and about. And remember, the coronavirus also lives on surfaces. So how long is debatable? Stainless steel might be 2 or 3 days. You know, plastics, wood, it's different. It's anywhere from a few hours to a couple of days, possibly. We're not sure. So there's contact. That's shopping cart. That's the rail. That's the whole. You're in the subway. You're holding. You've touched something that someone has touched that's infected. Now, then it has to go from your hand. Then you have to touch your face. You wipe your shirt, wash your jeans, you know, you hand wash, you kill that little fucker, bacteria, that virus, you kill it, you wash it, then it's gone. Now you touch your face all you want. But maybe you just, you know, because we randomly just kind of do stuff like this all the time. But coronavirus now has made its way, my hands are clean by the way, that has made its way now into your mouth, the oral airway, okay? So now, anyway, it's in your lungs. Now, what does it do? It targets your type 2 pneumocytes. And your type 2 pneumocytes has this receptor called the angiotensin converting enzyme. This is the receptor. Now, why is this important? Because hypertension, have you ever heard of an ACE inhibitor? ACE inhibitor? It helps regulate blood pressure medicine. Now you understand why people with high blood pressure are at risk, because this coronavirus targets this ACE protein, okay? And then it makes its way into this little, guy, makes its way into your type 2 pneumocyte. Now, I don't want to get too technical on this, but basically, it's going to make a bunch. Get too technical on this, but basically, it's going to make a bunch, all right? A bunch of little progeny. It's going to replicate itself, and then what happens? This cell will then die. Now, this is one little tiny cell of millions of cells, right? So it's this one little cell dies. But then what happens? Because the cell dies, there causes a huge inflammatory response. So your body then does a lot of stuff. It sends out a lot of interleukin 1, interleukin 6, tumor necrosis factor, alpha. So your body starts to mount an immune response. And it actually, your immune response, when it starts to rapidly get out of control, is actually how you die. It's your own body trying to save you, ends up really just killing you. Okay? So this dies. So the cell dies, and then when the cell dies, there's a huge immune response, and then the alveoli in here. So here we have an alveoli. That's these little air pockets you see in your lungs, okay? These microscopic air pockets here, all right? Your alveoli then brings in fluid, okay? Then fluid goes into your alveoli. Fluid goes into your alveoli, and it starts filling up with fluid. And what is that called when your alveoli fills up with fluid? Anyone know? And that fluid is like pus and debris and these response immune modulators. What's that called? Anyone know? So that is pneumonia. It's called pneumonia. And usually this is going to start lower areas of pneumonia. Why? Well, it's gravity dependent. It's going to make its way down low because it's gravity dependent. You're going to see this sort of stuff usually down low. Okay? It's a consolidation is what we call it. This is where it gets serious, guys. So please do me a favor. Please hit share. This is going to be super important. I'm going to do this demonstration real quick. All right? How this really kills you. Okay, now watch me now. So your alveoli, your lungs are filling up with fluid. So I have your lungs here, right? Lungs. Your lungs. Your lung, like deep breath, expands, gets smaller. Inhale, exhale, inhale, exhale. It gets oxygen exchange. It's doing what it's supposed to do. Does that make sense? Now, I have for you right here this bowl of water. It has red food coloring, but it's water. Now watch. Exhale, inhale. And suddenly, this coronavirus is going to come in, cause this massive inflammatory response. Watch this. And now your lung gets full. Oh, hell. Look at that. Gets full of liquid. At first, you can still work. All right? It's still working. But watch this. As this progresses, I'll leave that in there. And as more and more fluid comes into your lungs, I'm about to make a huge mess. As more and more fluid comes into your lung and you try to take a deep breath, look, it stiffens. When you have fluid into your lungs, does this make sense? It stiffens. It can't move. It can't move. All right? It can't get rid of the fluid. Now, remember what I showed you here, okay? The actual coronavirus is actually killing your pneumocytes. So your little alveoli ends up looking like, check this out, looks like this. See? It's all necrotic. It's all broken. It's all nasty. Healthy? Not healthy, because it's been destroyed. Now when that cell gets like this, now it's starting to bring in a bunch of fluid. And now, can't move. Can't exchange oxygen. And then it gets worse and worse. Remember the story? The pimp holding your breath underwater. Now you got huge masses of pneumonia, consolidation. That leads to something we call ARDS, acute respiratory distress syndrome. You can't exchange oxygen. Your lungs are literally dying with fluid. Everything is crushed in there. You can't breathe. You're literally suffocating underwater. If you've ever had like a breathing attack where you can't, I can't catch my breath. I can't catch my breath. That's what happens with this coronavirus. That's how it kills you. A lot of people sit there and wonder, Dr. Vuong, all right, so this is 80% of people, right? 80% are going to have like flu-like symptoms, bad flu. And then 3% of people, I know this is morbid, 3% will die. Okay, you guys follow me here? People go, Dr. Vuong, what happens between, like, how do we get from here to here? All right, well, the bridge to get from here to die, there's a bridge, and that bridge is pneumonia, specifically leading to something called ARDS, acute respiratory distress syndrome. At this point, once you get to ARDS, your lungs are totally consolidated. You got lots of pockets. Not only do you have your alveoli full of fluid, you also have fluid in your what's called your interstitial space, or the space between the cells. Your interstitial space gets fluid. So, you see the alveoli pockets I tried to show you, right? But also the tissues, your actual lung tissues around your alveoli get full of fluid. Like this one, right? And now, like, your lung can't move, and you can't exchange oxygen, and now you can't breathe, and now it's just like the pimp holding your head underwater. You can't breathe. So how do you treat ARDS? Dr. Vuong, once you start having respiratory problems, like you can't breathe, you're gasping for air, the timeline is really fast, right? If you ever get to this point, and God bless you, I don't want you to ever get to this point, you or any of your loved ones, but too many of us are about to hear this phrase. Your doctor is going to come in and say something like this: we are really worried that your mom is going to tire out. If you hear that, the next thing that's going to come is, we need to put a breathing tube in your mom. We need to breathe for her. We need to put her on a ventilator. We need to put her on a respirator, because we are worried she's going to tire out. So you're gasping for air, and your muscles will tire out. Your lungs are filling up with fluid, this interstitial fluid as well as the alveolar fluid, creating this consolidation. I can't get enough oxygen. I can't get enough oxygen. And that's how we die. And so the treatment is to put you on a ventilator. We are worried mom is going to tire out, so we put her on a ventilator. We're going to breathe for her. And the numbers are changing, but we think about 50% of the time, half the time you get put on a ventilator, they don't make it. The cascading event is just too big. It turns from a lung problem to then what's called sepsis. You have other organ failures. So what happens when you can't have enough oxygen? What happens when your heart doesn't get enough oxygen? Well, you're going to go into cardiac arrest. What happens when your liver doesn't get enough oxygen or blood flow? Well, you're going to have, inflammatory markers in your liver. You're going to go into liver failure. More importantly, your kidneys. What happens if your kidneys don't get enough blood flow? You're going to go into kidney failure. And we just don't have that many dialysis machines. We don't have enough ventilators to handle this small amount of people who are going to need it. Trust me, okay? So let me tell you real quick about the numbers, because